Indians are master of stirring up a storm in a teacup during their lively chats. But in Assam, in an unassuming and quiet tea garden called Dumduma, two ordinary individuals brewed something far more impactful in their cups. An idea that still saves millions of lives worldwide. Yet, how many in Dibrugarh remember them today? And while the world honors their contribution, why hasn't India fully woken up to their legacy? Even as a surgeon, it took me years to truly understand this. When we feel unwell, be it headache, stomachache, or fever, we often rush for diagnostic tests. These are what we call diagnostic tests. But there is another fascinating realm: tests conducted on perfectly healthy individuals, known as screening tests. Let's be honest, if we don't have symptoms, we assume we are healthy. Yet, scientists argue that these screening tests for the seemingly healthy can save countless lives. So, why is that neither responsible citizens nor school children are aware of this? It's time we asked ourselves this question. The concept is not hard to grasp. We visit doctors only when something feels off, but even when our bodies might be silently brewing trouble, problems that go unnoticed due to the lack of symptoms. Here is a simple example to illustrate. Let's say blood pressure. It is estimated that out of every 100 people, 46, that is almost 50%, are unaware that they have high blood pressure. A simple test can reveal this condition. Clearly, if identified early through routine testing, treatment outcomes and overall quality of life can significantly improve. From more affordable care to better health management, early detection makes all that difference. Yet, many people avoid getting tested out of fear, as if a simple test will let the secret out of the bag. Next example, diabetes. Amongst every 100 people living with diabetes, 50 are unaware of their condition. With no obvious symptoms, they mistakenly believe they are healthy. Even with infections like norovirus, responsible for stomach upsets, about 21% of these infected do not realize they are carrying the virus. Norovirus often stays hidden, quietly weakening the body and passing from person to person. Now, an upset stomach may resolve in a few days. Even for blood pressure and diabetes, we have effective medicines. But what about an HPV infection? 3 out of every 4 seemingly healthy individuals carry human papillomavirus in their body, often without any symptoms. As long as HPV does not cause visible signs, such as cancer in the cervix or throat, it remains completely silent, often staying in the body for 5 to 15 years. During this time, we miss the critical window for effective intervention. Unfortunately, even many otherwise healthy women never consider they have or they might have HPV. Yet, tests to detect HPV and screening methods to prevent cervical cancer have been available for over decades. Still, in India alone, we are losing as many as 8 women per hour simply due to lack of awareness. We rush to get diagnostic tests done only when we feel unwell. But what about when we feel healthy? Maintenance is the best done when we feel fine. That's exactly when screening tests like HPV tests should be done at 3 yearly intervals. Science itself took time to understand how screening tests could be implemented. After all, health education has long shown that people only turn to tests when they reach a crisis point. Wilson and Jungner. Before this, idea that one could remain healthy by getting tested early was hardly considered, until 2 brilliant scientists, Wilson and Jungner, introduced a groundbreaking concept. Not only did they identify the importance of screening, they also set down 10 clear guidelines to prevent the unnecessary use of these tests. Because the moment we say this screening saves lives, countless corporate hospitals and test manufacturers might exploit the fear and confusion of the public, marketing from head to toe health checks as screening tools. They can turn preventive care into profit-making industry, leaving people anxious and overwhelmed. To ensure that healthy individuals do not fall ill out of fear of testing, Wilson and Jungner laid down 10 core principles. These guidelines, formulated in 1968, remain sacred and universally accepted. Since then, every responsible health institution in the world continues to follow them, faithfully and unchanged. Maxwell Wilson. Dr. James Maxwell Glover Wilson is regarded as one of the founding figures in the science of public health screening. Interestingly, his connection with India runs deep. Having recovered from tuberculosis himself, Dr. Wilson left England with his young family and relocated to Dumduma Tea Estate near Dibrugarh, Assam. At that time, his tea estate used to supply tea to the Brookbond Company. He was serving as a physician for the tea estate workers. 13 plantations fell under his care. After witnessing the widespread illnesses and suffering faced by tea workers, he began to ask a deeper question. By the time someone is ill, most of the battle is already lost. But can something be done earlier? This line of thought brought him to the contact with Axel Hoser. The Swedish doctor Axel and his wife Signe had long been urging Swedish government with a simple plea: enough of treating disease. Can we now shift focus to preventing it? But despite their efforts, Axel's calls were unanswered. Eventually, he even retired and moved to Assam to serve as a professor of preventive and social medicine at Assam Medical College. He made his home in a quiet corner at an unnamed tea garden. It was here he met Dr. Wilson. Deeply inspired by Axel, Dr. Wilson, who was much younger, returned to England and dedicated his entire life to one cause: finding ways to keep people healthier before they ever fell ill. Around the same time, in 1948, National Health Service, or NHS, has just been established in UK, driven by the belief that healthier people would mean reduced healthcare costs and less suffering overall. In the encouraging environment, Wilson's research into disease prevention and screening flourished. There was strong political and academic will in favor of public health enforcement at that time. Gunnar Jungner. At that very same period in Sweden, another visionary was advancing the science of preventive medicine, Dr. Gunnar Jungner. He spearheaded what would become the globally renowned Farmland Survey. Initially, even the Swedish government was hesitant to fund this new kind of research. Dr. Jungner burst on independently, launching his research with personal initiative only. It was not long before the findings turned heads. From 1962 to 1965, Jungner's team conducted a massive study involving over 100,000 healthy individuals in farmland, Sweden. More than 1 million tests were carried out, including measurements of weight, height, blood pressure, tests for tuberculosis, cancer risk indicators, and wide array of blood tests. Through this work, Dr. Jungner demonstrated with data and real-world cases how 5,500 people could be diagnosed and treated successfully before any symptoms had even appeared. Eventually, Dr. Wilson from England and Dr. Jungner from Sweden came together to co-author a landmark report. The work was published by the World Health Organization, WHO, and to this day remains a cornerstone in the field of preventive medicine and public health policy. The book. The name of that landmark publication, released in 1968, was Principles of Early Diseases Detection, WHO monograph number 34. Later, this research was refined and expanded into a more comprehensive volume titled Principles and Practice of Screening for Diseases, a book that even after 47 years continues to guide people towards a healthier life. But we are human. Have we truly been moved by it? We are often far more fascinated by the engine of a newly invented aircraft than we are by the efforts to keep our own body healthy. The world has reached space, yet how many schools actually teach about screening tests? Those very tools that represent some of the proudest achievements of medical science. How do screening tests save lives? In what ways can screening tests genuinely extend and improve lives? Let's take a closer look at the 3 glaring examples. Number 1, PAP Smear. Starting from the age 25, a simple PAP smear once every 3 years can detect cervical cancer while it is still silent and asymptomatic, allowing us to defeat it before it even begins. Number 2, Occult blood test. After the age of 50, a yearly fecal occult blood test can detect hidden traces of blood in the stool, an early sign of colon cancer. You are right, that's before, much before, the stool becomes red. This test can identify the disease well before the stool visibly shows red and can save lives through timely intervention. Number 3, mammography. For breast cancer, mammograms are advised every 2 to 3 years from age 50 onwards. But how many of us actively remember to schedule these life-saving screenings? Time and again, the World Health Organization WHO has shown that simple, affordable tests like these, when done regularly, increase the chances of early detection and successful treatment, significantly improving the outcomes. There was once a time when the average human life expectancy ranged between 23 and 25 years. Today, in some countries, we are approaching 85 years. This progress rests upon three key pillars: vaccination, screening tests, and quality of life, all driven by the most important factor of all, awareness. Some screenings are done for us without even realizing. Some screening tests are performed automatically, even before we fully understand their significance. Today, shortly after birth, almost every child undergoes a set of early screening tests. Checks for hip joints, fingers, stool, and urinary pathways are conducted, along with approximately 6 crucial blood tests. Together, these helps in detecting a range of medical conditions from very beginning. Why then a screening test is not available for the adults? And yet, when the same child grows into a responsible adult, they often have no understanding of what a screening test even is. The time has come to reflect on these scientifically celebrated tests, not only for our own well-being, but for the good of society as a whole. If screening tests can truly save lives, surely the solution is simple. Just go ahead and do them. They are not even very expensive and they can prevent countless deaths, right? Well, if it were that simple, it would have happened already. The reality is, we readily agree to undergo tests when we are shivering with fever or doubled over in pain. But when our bodies feel well, neither the patient nor often the country sees the need. In truth, it is the responsibility of governments to take the lead on the screening, because better screening means a healthier population. So why then are we still not seeing universal screening? We have looked closely at the reasons. It requires leadership. For screening programs to succeed, there must be a strong, effective leadership. This must be backed up by the clear roadmap, with entire healthcare system aligned to support its goal. Number 2, it needs skilled personnel. Qualified health workers must be available to carry out these screening tests. How can there be a shortage in a country like India with over 1.46 billion people? In fact, India's well-trained doctors, nurses, health technicians are leading screening initiatives abroad, improving the health of citizens in Western world nations. But where are they within our own country? One almost needs a telescope to find them. Number 3, it demands public information. A neutral, nationwide flow of accurate information is essential, through newspapers, television, radio, all forms of media. Yet, in the media ecosystem, where every second of airtime and every inch of print is driven by sponsorship pressure, where the income of media professionals is directly tied to advertising revenue, can we realistically expect widespread dissemination of non-sponsored education orientation about screening tests? I do not know the answer. Number 4, it requires funding. The funding must come from taxes. While the cost of screening tests is modest, implementing them requires a nation and its citizens to hold strong ideals. How many governments are genuinely committed to making regular screening a public funded promise to all? The answer remains to be seen. Number 5, it must ensure follow-up care. Once screening identifies individuals with health risks, who will treat them? That phase undoubtedly incurs higher costs. It appears that this 5th point is where India's screening tests come to a halt. Why does not everyone get screened? There seems to be no easy answer. So, what's the solution? In a country like India, we must take the initiatives to raise funds for screening tests ourselves. Of course, we must begin with ourselves. But it is equally our responsibility, our sense of humanity, that must extend to form a small circuit around us, perhaps 10 people around each of us, especially those who cannot afford such screening tests. If each of us are able to offer a little support to those in need, only then will the nation move forward. Only then our society will progress. That's all today. See you soon with another video research article.
you.